So this topic we're going to cover women's health and also men's health. I'll start then. So women's health generally covers your menstrual female, so from sort of pubescent age, going through different life changes, you're pregnant, postpartum, perimenopause, menopause, to kind of say it in a nutshell. We treat all of those sort of ages, I think, don't we? Yeah. Specific conditions that might be related to that, and we can probably chat a little bit more about, is your sort of menstrual age. If they are sporting, the cycle could be affecting things going on, such as the training ability, if it's not met with the right nutrition or recovery, might be sort of going into that like RED-S, that relative energy deficiency in sport category, which we can discuss a bit more about. You've got your pregnant population in terms of conditions they might sort of struggle with, generally back, pelvis, groin, pubic area, nervy pain around the glutes, the hips, the legs, restless legs, generally more sort of pelvic lower body, but also might struggle just because their anatomy's changing, the joints are changing. Upper body, they might just be getting really bad headaches because obviously shoulder, neck, tension in their upper body. We've got your postpartum sort of initial stages, depending on what type of birth they've had, whether it's been vaginal, whether it's been cesarean. Again, anatomically, things will change. Could be straightforward, might not be. Those changes might be evident initially. They might only be evident years down the line. So obviously sort of scarring from cesarean, weakness in the abdomen. Also sort of any sort of weakness in pelvic floor. And pelvic floor, I like to kind of explain to people, is, it's not just like your abs, it's kind of like everything in your pelvis. And that's obviously important for your males and your female population. And we categorise it into different areas as well. So it might be your lower abdomen, it might be more in like your pubic area, and what sort of issues you can get with that, whether that affects sort of incontinence, obviously bladder, bowel function, sexual dysfunction. All those sort of things can be affected by pelvic floor issues. Weaknesses, but not just weakness, you can be sort of overactive in certain muscles as well, so constantly active and overstraining, and then that can adjust pressures internally and push things out more than it should be. So it's not always a weakness or a trauma internally because of that. That being same for males as well. Males can suffer with underactive and overactive pelvic floor. Then we've got your perimenopause, more so because your hormone changes in your body. Your nutrition might be different as well, so you kind of might be suffering more with like things that you were discussing before, like your hip pain, your bursitis. Because of your mood, you might be doing more or less exercise, which can have effects as well. And obviously your menopause, if you're really struggling with your hormone changes, your hormones might be like this, but it might be like that in a week or a year, is completely different to Jill's, who might be, I breezed through the menopause, I didn't have any issues. And I can only imagine how frustrating that must be for someone that they've had a friend or a sister that's been absolutely fine and no issue through menopause, and then personally really struggled for years.
One thing, I often feel like I'm repeating myself that's because we all do. We come up with phrases, don't we? And you think I've said this 4 times today. The sort of conversation I have with people or women more postpartum, sometimes it's even years postpartum, they'll come out with the phrase of, "I've had a bad back since we had our Billy," do you know, or something like that, because every kid's called Billy. And you say, well, why? Do you know, why have you put up with it? And little Billy's 6, you know, that type of thing. And the phrase or the sort of comment I always make is, for whatever reason, people, whether it's doctors, general population, us, whatever, people expect the women to just spring back. Like, you give birth, like you said, whether it's vaginally or C-section, whatever, and they just expect it's the most natural thing in the world, and you just spring back to normal and get on with it. There's a baby, look after it type thing.
Yeah, it's just not accurate.
It's not, and it's a huge trauma. massive trauma. It's a massive injury, is what I always say it to people. So you have this huge injury. If you ruptured your Achilles, or you tore your ACL, or you herniated a disc in your back, you'd do some sort of rehab for it. You'd do some sort of exercise. You'd have a plan in place, and you'd get it better. You'd get stronger. You'd recover, and you'd come back out the other side of it. But for whatever reason, the pregnancy and childbirth sort of categorised in something completely different on its own. But realistically, if you see it as an injury, you go, right, well, we've given birth now. I know we've got this little baby we've got to look after now, but we have to be doing these steps. We have to be doing this, like I said, your pelvic floor, your transverse abdominis, your low level strength exercise to build up that pelvic strength again, to then put you in a good place moving forward. Where all that happens really is they end up being really weak in those areas. They might have split abs, all sorts of stuff, and then they end up with chronic lower back pain because everything around the pelvis just isn't functioning properly. And it's almost like when you explain it to them and you say, you've had a huge injury, you've just not rehabbed for 6 years.
Yeah.
It then clicks. Do you know? And they say, oh yeah, I never thought about it like that. It's not really a difficult concept to get your head around, but for whatever reason, whether it's a society thing, there's just an expectation that women just spring back to normal after childbirth.
I suppose, like, when you've got a newborn, you're in this whirlwind of like just adjusting to survival mode, and you kind of put yourself at the bottom of the ranking order, and then other things come in as they go through the different ages, more things to juggle, and you kind of just still at the bottom of either fixing it, or you just think, oh, I just thought that's what it was. I've had a lady in last year, and she came and she had a really quite significant abdominal separation following her children, who are now both in, of school age, and she just was told it's just the norm. Yeah. And it's kind of like, but anatomically it's not, because that's causing you a massive stress on your lower back, and hence that's why she came to me, because of a lower back pain, not because of the abdominal separation. But she was just kind of like, just live with it, just get on with it.
Yeah, I would. I have to talk. I use the word trauma rather than injury, but it's the same principle, isn't it? That it is a huge energy sapping thing that goes on. From obviously growing the baby, giving birth to the baby, supporting the baby, the hormonal changes, the sort of how long it takes to sort of 18 months, 2 years for the hormones to settle back to, potentially settle back to what they were prior. Obviously, I think probably this situation, and having a 10-week-old baby today, she is, and my wife had a C-section. I've probably, I've really seen that, and how she's had to, sort of progress in the stuff she wasn't able to do and then now can do, but some of the other sort of side effects of that. But I think, like you said, in what other situation would you have major abdominal surgery and then 24 hours later discharged?
Exactly.
So she was back home looking after her baby 24 hours after, sort of having been opened up. So I think there is those, again, there's a medical side, but there's also like a societal side, isn't there? And I know, like I say also as well, you're just having to survive, aren't you, as well? So you're having to get through those moments, and probably why it is 6 years later, because, you give birth and 6 years later, you're like, oh yeah, I've got that back pain, and before I could do that, I get looked at.
Oh, not a while.
And I think there's that as well. So I suppose, obviously, knowing what I know and everything else, I've been speaking with my wife about that, about making sure that we get about little by little. But again, also being realistic, because she can get frustrated with things. It's like, well, yeah, but all random things keep happening, like random sensations, like sort of her knees were really sore with it, but it was sort of bilateral. So well, that's hormones. That's like, it's not other things. So it's, I suppose I'm lucky in that respect, that I know I kind of, through different reasons, I know what we're going through. But we do need, when we're speaking about postpartum stuff, that needs to be, because that obviously menopause is massive. I know we've talked about that before, but I think that I would say postpartum isn't actually as big. And like you say, don't get me wrong, there's some women who can have a child and then a month later go for a run. But it's still, it's all, and with all these things, and again, that's what, it's hard. With a lot of the things we keep talking about, these different topics, there's a lot of nuances within it, and we have to, so it's not saying don't run if you can't, like, oh, you're a month or whatever, just for argument's sake, but also don't feel pressure that actually it might take you 6-12 months to get anywhere near what you were like. And understanding those, you said physiological changes, and we know about obviously relaxing, causing the changes around that pelvis and other ligaments. It's not like it just separates, baby pops out, goes back in. It can separate. It's not going to be, those changes can be, forever. That's, so again, trying to make sure that from our job, helping people understand that, but also there's strength around those structures and function as best we can.
And that postpartum period, it isn't that sort of, I think prior to being in that situation, and I suppose seeing more and more of it over time, it's not your 6 weeks, you know, you have your 6-week check at your GP, which unfortunately, you know, we know the strains in the NHS, that's quite limited what they actually cover in terms of your physiology and your psychology. You've not recovered in 6 weeks. It's a long journey for some people. Like you say, it might be a couple of months, it might be years. People might be living with long-term traumas, but it's completely different to that individual. And again, I think in that population we understand because we've always treated it, but it's our family lives as well. But how do you know, it's all very well, you know, busy mum coming in, juggling everything. Right, you've got to give yourself this hour. You come to me, we talk about what's going on, we'll do some manual treatment, and this is what you need to do in between. I've not got time for that. And it's like, I understand that. I'm not giving you a big gym program that you've got to go to the gym 4 times a week. It'll be little cues, it might be activations, and we build up from there. It's baby steps. It's, I think, goal setting and being realistic that, look, we know you can't do that, but in order to make a change, you've got to do these little bits and bobs. It might be something whilst you're brushing your teeth, whilst you're driving your car, but they add up together.
Yeah, I think another thing with that population is, and it's not as much of a discussion with, well, it isn't a discussion at all with male population, is taking into consideration menstrual cycle, that time of the month. Do you know, when you sort of asking people to train, to exercise, to finish a training program, you've got to take that into consideration with the sort of energy deficiency around that time. It's funny enough, it was something we spoke about with my wife the other day, for the record, obviously I know you know her name. But we talk about like Olympians, you know, like Rebecca Adlington was a prime example as how she managed to get all the way through a career to train at that level, having to deal with that every month. Do you know, is it, and again, this is a question I actually don't like to know the answer, is this a case of she's had like contraceptive medication all the career to make sure she's training at that level? Would she have time periods
off?
What sense
do you mean,
like to stop a period?
Like
basically.
contraceptive type style?
So yeah, would she stop a period for the whole of her career until she retired, and then try and get to
well, obviously
normal,
she can't,
normal,
can she?
exactly.
Yeah, I know.
So, and this is the thing that you've got to take in, that again, I don't think people quite understand of how much more difficult it is for someone like that to manage the training load.
Yeah.
Alongside, like say, if we're being obtuse about it, blokes, you know, we can just do it. Do you know?
I forgot half a story here, but I can't remember if she was a sprinter or I feel like she's a sprinter, but might have been weightlifting. But I think Bobby, I've got B or BBI, something. I've got again half a story, but it's quite a famous case with her. It was on the BBC as well, where we were talking about energy deficiency. She basically got like sort of osteoporosis, like kind of young age, some kind of bone stress injury. It might not be, it might be osteopenia, but it wasn't either way. It was because of that, you know, overtraining, energy deficiency, you know, like sort of, you know, like again, carrying that sort of amenorrhea, which basically is the altered periods and stuff. And it's again recognise that, and I've had that before. I remember like a young girl, and I sort of had to, you know, bring that, you know, to speak to her parents about it, and it's quite good because there's some good information around Red S, and there's a research journal paper, sorry, part of a journal, but it was only like that big, and it was quite easy to the parents, and then I think there was some stuff potentially around that, and just helping them, and that's where the education comes in, doesn't it? So, but the Red S, we know it's not just a female thing as well, is it?
It's a male thing. Yeah.
Within that, you've got the female athletic tribe, but the Red S